If you're planning to start your family, then Bangalore is one of the good options for IVF treatment. Today I'll be talking about IVF treatment and how this process is done. Generally, IVF is done for couples who have low or absent sperms. If there is a block in the tube, there is severe endometriosis, severe PCOS. These are some of the absolute indications for IVF. Other indications could be if you have failed 3 or 4 IUIs in unexplained infertility. So this process starts with initially doing a scan on day 2, checking your hormone levels, how they are, and then giving you injections for 10 days. These injections are hormonal injections. They are usually painless and they are without any side effects. They are given to make all your eggs seen on day 2 to grow to a certain size, around 18 millimeter in size. That is around the 10th day, plus or minus 2 days, because it's a personalized approach. And once it reaches that size, we give a trigger injection. And after that, usually 35 hours later, we do the egg pickup. During this process, you are given a small anesthesia, which lasts for 10 to 15 minutes. And to transvaginal route, we are going to retrieve the eggs. Then the husband is ejaculating and giving his sperm sample. We take the best sperm, do the process called ICSI in a petri dish in a lab. Then the embryos are grown and they are evaluated on day 3 or day 5. Day 5 is called blastocyst stage. This is the normal state which the embryo implants in the uterus. So we do a grading at that stage and we give different grading for the embryo, A grade, B grade and C grade. So depending on that, we freeze the embryos after counseling the patient. Most of the cycles nowadays done a frozen transfer. So usually we do the transfer in the next month. We prepare, the first step is preparation of the seed and the next is the preparation of the soil. So we want the endometrium to be between 8 to 12 millimeter when we do the endometrial transfer. So we give some hormonal medicines for improving your lining. And after preparing your endometrium, we give 6 days of injection progesterone and then we transfer. 14 days later, we do the pregnancy test. This is the whole cycle of the IVF treatment. And it's very important you do it in a good lab, and Bangalore is definitely one of the popular destinations for IVF. And the success rates with the latest advancements in IVF comes to around 60 to 70%. So if you're planning or considering IVF as a treatment, I hope this video you find it useful.